All right, so chapter 6, diseases of the nervous system. Before we even go any further, guys, on what this chapter is about, okay? Let's see here. Let's talk about the nervous system and what is nervous system really is, okay? Okay, so the nervous system. This is one of the most, I think, one of the most complex systems in our body, I should say. Okay, it's not simple. Quite complex, of course. It's not simple, right? Um, we have when we talk about nervous system, guys, there are two major divisions. I don't know if that is the appropriate name for that or call for that, but I'm speaking in a layman's term, okay? Two major divisions of the nervous system, okay? The first one is the central nervous system, and the other one is the peripheral nervous system, okay? Clinicians, nurses, you guys know about this, okay? But for us who are not, have not studied the medical course, it may sound foreign to us, okay? But what I'm telling you now, guys, is the nervous system is divided into two major divisions: the central nervous system and the other one is the peripheral nervous system. Now, what is a central nervous system? Central nervous system comprises comprises of or comprise of our brain, okay, and our spinal cord. Okay, so our brain and our spinal cord. So that's your central nervous system, which means that everything that everything that our body is allowed to to have that range of movements, of motions, okay, has something to do with how our brain and our spinal cord really dictates. Okay, so but it's not just the movement. It's not just about the range of motions. It's also our cognitive function also has something to do with how our brain works. Okay, our memory, our ability to speak, our ability to swallow. There are thousands of little body functions that our central nervous system is allowing us to be able to do. Okay, so that's in a nutshell, in a layman's term. I'm trying to make it more simple as the best I can, guys. That's what the central nervous system role is. Okay, the peripheral nervous system is something our system our nervous system that is away from the center. Okay, so our extremities, our arms, our legs, they have nerves as well. Okay, so these are, of course, these nerves are the ones that tell the body if the body is in pain, right? If the body is experiencing numbness or temporary paralysis. So they are all connected in, of course, from the central nervous system, and they are also interconnected to the peripheral nervous system. Okay, so when you talk about and when we say peripheral, which that means to say these are part of the body that is away from the center of the body. Okay, so again, in the layman's term, I'm trying to explain that the best I can. Now, the nervous system, guys, is not just about all these ranges or these functions, range of motions that our body is able to perform. The nervous system is also responsible to in communicating to our body if the body is in pain. Okay, so if a body is in pain, it is our nervous system that tells the body, if the body's in pain, then we we perform specific actions to mitigate that pain. Okay, so again, it is our nervous system that does that, or that communicates that to our body. Okay, so in this chapter, guys, we're going to be talking about this different functions. Okay, the you know, if a patient has neurological disorders, neurological dysfunctions, we're going to be talking about pain as well. And how are we going to interpret them, how to determine the appropriate code to assign if, you know, if a patient is experiencing some paralysis, how do we do that? And this is in this chapter we're going to be speaking about that. Okay, so you guys ready? Now that I have given you a little background of, you know, of my say best attempt to explain to you what nervous system is. Again, guys, nervous system is very complex. That's why neurologists are the gods of medicine, guys. Gods of medicine. Yeah, those neurologists and cardiologists. Those are really highly complex field of medicine. Okay, let's switch my, I'm going to switch my screen to the system, guys. So I mean to the guidelines. Okay, so dominant / non-dominant side. Okay, let's read. Goes from category G81. Okay, hemiplegia and hemiparesis, and subcategories G83.1, monoplegia of lower limb, G83.2, monoplegia of upper limb, and G83.3, monoplegia unspecified. Identify whatever the dominant or non-dominant side is affected. Should the affected side be documented but not specified as dominant or non-dominant, and the classification system does not indicate a default code, selection is as follows. Okay. For ambidextrous patients, the default should be the dominant. Okay. If the left side is affected, the default is non-dominant. If the right side is affected, the default is dominant. Okay, I know it's a lot to take in here, guys, but let me unpack this and let's dissect this guidelines, guys, for us to be able to understand clearly what does this mean. Okay, all right, so it's the one that we just read, guys, talks about paralysis. Every time you hear the word plegia or paresis, it talks about paralysis or temporary loss of function. That's what these plegia or paresis mean. Okay. Now, what the guidelines are saying here is that if a patient suffers a paralysis or a loss of function, okay, weakness of the arm, weakness of the leg, okay, there are rules to follow what code you should apply. Okay, there are rules to follow. Okay, so I'm gonna erase the board, what's on the board, guys, and we're just gonna include the number 2 scenario later in our discussion, okay? Because I want us to be able to use this and show you guys what I mean about dominant and non-dominant side as the coding guidelines have indicated earlier, okay? Okay. So, and I'd want you to listen here, guys, very intently, very carefully, because this question or this part of the nervous system coding guideline always appears in the exam. Okay, they always come out in the exam, so I'd like you to really pay attention here very carefully. Okay, so we're talking about dominant, okay, and non-dominant. Okay, these two terms here, dominant and non-dominant, everybody knows what those mean, right? But in the coding of the nervous system, guys, it is a big deal to be able to identify whether the patient is right-handed or left-handed. Okay? Here's the reason why. The guidelines say that if there was no documentation saying that a patient is whether patient is left-handed or right-handed, the rule to assign the code for would be, okay, let's go back here again. For ambidextrous, you guys know what ambidextrous is? Ambidextrous is a person who's able to use both left and right with equal strength or with equal efficiency. You know, if you guys are following NBA, LeBron James is actually an ambidextrous. Okay, he's actually he's left-handed, but he can use his right hand as efficient as the left hand. That's what LeBron James is. Okay, ambidextrous. So ambidextrous, if there was no mention about, you know, whether patient is left-handed or right-handed and patient is obviously ambidextrous, the default side is dominant. If it's a right-handed, that is your dominant. If it's left-handed, that is non-dominant. Now, I know I keep repeating these terms, dominant, non-dominant, but this is how it applies in the coding, okay? If a person's paralysis is on the right side, you are to assign a code that says paralysis on the dominant side. Let me repeat that. Nothing is documented whether the person is right-handed or left-handed, okay? Because few doctors do that. Few clinicians even go that far to indicate or to document if a person is left-handed or right-handed. Not unless you work for a neurology clinic, that could be, that could be the case. But most doctors, if not all, okay, would rarely document the patient's, function, whether dominant or non-dominant. Okay, so in the absence of that information, okay, if the paralysis is on the right side, you always assume it is the person's dominant side. Am I clear? If the person's paralysis is the left side, you always assume that the left side is patient's non-dominant side. Why? Because universally, there are more right-handed people than left-handed people. Anyone here is left-handed? There are how many people we have here? We are 10 people right now. I am right-handed. Anyone who is left-handed, guys? See, there's 10 of us and no one is left-handed. So everybody is right-handed. So this is exactly what the guidelines are saying, that you always assume that a person is right-handed. So if there's no documentation to that effect, that a patient is right-handed or left-handed, it is already assumed that a person who suffers paralysis is always right-handed. Now, how is that applicable to the code? I want you guys to look at this code here, G81, okay? G81 code. Everybody, G81 or G83? Okay, let's just go to G81, please. G81.90. I think that's the code. Everybody, please go to the book and let's look at that code, G81. And I believe it's G81.90. Okay? And tell me, guys, if you have found that code, G81.90. And I actually have it. It's on page 602 in my book, 602. G81.90. Okay? All right, so let me read, guys. Let's start with G81.90. You guys ready? Okay? You guys ready? G81.90. You found it? Okay. All right. So let me read, guys, what G81.90 says. It says here, hemiplegia unspecified affecting unspecified site. Hemiplegia. What is hemiplegia, guys? Hemiplegia is a paralysis of the half of the body. Okay, hemi means half, plegia means paralysis. So every time you hear this term hemiplegia, it talks about person's half of the body is paralyzed or experiencing weakness. Okay, or temporary loss of function. That's what hemiplegia is. And hemiparesis, yes, Karen, and hemiparesis, in the coding context, hemiparesis and hemiplegia are the same. But you know, if you go look it up, what hemiparesis really mean, hemiparesis is temporary loss of function. That's what hemiparesis is. Hemiplegia is paralysis. Okay? Now, I'm pretty sure that you've seen someone who is whose half of the body is not working. Have you guys, has anyone seen that? I'm pretty sure you guys have, right? So yes, so half of the body is not working. A person's dragging, you know, his feet or her foot, or you know, and the upper limb is not working, right? That's hemiplegia. Okay, when you talk about monoplegia, it talks about only one limb. Okay, so that's the difference between hemiplegia and from monoplegia. Monoplegia means one limb, whether upper or lower limb, is paralyzed or has lost, has a temporary loss of function. Okay, so that's the difference between hemi and mono. So hemiplegia. Now, the G91 here, guys, G81.90 is hemiplegia, but there was no documentation which side was paralyzed, whether it is the right side or the left side. So when you're assigning a code G81.90, you're basically telling the next user of the chart, okay, that patient is paralyzed, half of the body is paralyzed, but I did not specify which side is paralyzed. Okay, and that's a bad coding. Okay, it's not, you know, it's not comprehensive, it's not specific. So I'm saying when you see that G8190, it's a lazy coding, guys. You have to know which side is paralyzed. Okay, now when we go to the next code, G81.91, okay, what does G81.91 say? Let me read the code description here. It says G8191 is hemiplegia unspecified affecting right dominant side. Okay, affecting right dominant side, which means that this is a person whose paralysis is the right side. Okay, and what does it say? Hemiplegia affecting right dominant. Okay, right dominant, which means that, okay, whether the person's side was identified as the dominant side as is right side, or there was no mention of the patients whether right-handed or left-handed, but the paralysis is on the right side. Okay, now look at G8194. Okay, let's jump to the last subcategory here. G8194 says hemiplegia unspecified affecting left non-dominant side, which means that if the paralysis is the left side, you code it as non-dominant left side. Okay? Does everybody now understand why it is necessary to recognize that? Okay, whether it's the left side or or the right side. It may sound confusing for now, guys, but I'd like you to repeat that over and again, because there is also something that's called right non-dominant. And when do you use this right non-dominant? If the paralysis is the right side, okay? This is our right side right here, okay? If this right side here is paralyzed and I happen to be left-handed, is that correct? If I happen to be left-handed and my paralysis is the right side, you are to code me right side non-dominant because I am a left-handed person. Am I making sense here? If the paralysis is the left side right here, okay, and I'm also a left-handed person, okay, I am also a left-handed person and my paralysis is left side, you are coding me left side dominant, right? I know using right it makes more confusing, but that's what it's for. That's how it works, guys. So I mean, like, just repeat, read it, repeat repetitively until it clicks to your brain. I know, you know, when I was studying this, I had the same, like, what? Yes, yeah, Brittany, her brain is going just like anemia. Yeah, so I mean, like, it is that important that you know, in the exam, in a AHIMA exam, I heard that this came out. Okay, it is kind of like confusing. Yeah, that's why I did not have you guys. I elected not to talk about number 2 scenario because the number 2 scenario has something to do with this, right? Okay. Okay, so that's what these you know, this neurological deficit or residual effect, you know, should be coded. You got to remember, okay? Like I said, guys, very rarely doctors would report or would document the patient's function, you know, patient's dominant or non-dominant function. Okay, very rarely that doctors use that. Doctors do not go out of their way and reporting patient is left-handed or patient is right-handed. So generally, okay, how you code it is if it's the right side dominant. If it's the left side non-dominant.